last course session today, end of the academic year. So we will, move forward with new plans, new critiques in the coming year. But let me introduce Dr. Chu. He's a legal surgical oncologist and illegal traumatologist. We had some moments this week in the OR. Illegal traumatologist. Some thermonuclear action by him in the OR. He became not CHU, he became CHEW. Chu. He was chewing somebody in the OR.
Well, thank you very much for this privilege. Trauma is very different than elective. In trauma, that patient's life depends on us. Every millisecond counts. Family depends on us. That gentleman, the difference between him going home to enjoy Thanksgiving and 6 feet underground is how you coordinate everybody. Trauma is chaos. Your role as a leader is to control that chaos, to decrease that entropy. Everybody's doing everything. You need to tell everybody, stop. If your name is not Dr. Samra or Dr. Chu, please do not talk, because it's very, very loud and very noisy, right? You've been there. Anyway, we're not talking about that. Today, we're talking about genetics of cancer. Many of you thought that after the first or second year of medical school, that's it, you will never see it again. Thank God. Today, many of you may have also sought therapy lessons, therapy counseling. So forget it. Today, I may have destroyed months of therapy for you guys, but hopefully not. To understand cancer, there are several concepts that you need to understand, and there is no way I can do justice to this topic within a 45-minute span. My job, and I always consider the professor's job, is to give you the essence, to stimulate you, to get you to understand, to get you to be excited, so that you will go back and read it. So that when you read it, it makes sense. All of you are very intelligent. You cannot get here without being intelligent. Period. All of you are very intelligent. Unfortunately, the concepts are not innate. We were not born to understand the genetics of cancer. We were not born to understand Gibbs-free energy. It's the concept created by highly intelligent people to explain the world around them. And the only way that can impart that for you to understand it is to write it, to try to convey the message, and it's your job to try to read and try to understand it. If you don't understand it, it's not because you're an idiot or you're stupid, albeit sometimes I make you feel that way, but it's not. It's because you're not spending enough time, or you're not seeking out the right people to ask. Many of these concepts are very interesting. I hope that by the time that I'm done, you get a flavor, you want to go back and read about it, and you want to say, you know what, doggone it, this is something I never understood, I finally understood, I'm excited, I want to go and read and understand more about it, okay? Let's begin. We cannot talk about genetics without going back to the basics. And we cannot understand the mechanisms that I'm about to explain to you without going back to understanding the construct of a gene. As you all remember, a gene is just a bunch of 4 bases, right? But they have a message in order. Okay? It has the coding sequence. If you recall the dogma of genetics, it goes from DNA to RNA to protein. Correct? I want to sidetrack a little bit. What is the effector at the end of the day? Is it DNA? Is it RNA? Or is it the protein? Can be all, but generally it is the protein. You're right, can be all, but generally it is the protein. The protein is the effector. What does that mean? You may have abnormality where the DNA is amplified, but for some reason the protein is not amplified. Who cares? Okay? So that's why sometimes people will write papers and write about how they observe the DNA is abnormal, the DNA is high, blah, 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 blah. And my question is, sounds great. Good observation. But tell me, what is the translational aspect of it? In other words, what is the product? If you don't show me abnormality of that product, it doesn't mean anything. It's just an observation. So far, so good? But we need to understand, but in order to have the product, you must have the DNA. Okay? So the gene has a promoter region at the 5' end. And the promoter is where everything attaches to it and tells it to go. Right? You have DNA polymerase, RNA polymerase. It goes and it scans and it finds a promoter. It doesn't scan from here. It doesn't scan from here. Or it scans the DNA. Once it finds a promoter, it has all these other transcriptional factors, et cetera, et cetera, et cetera. Then it starts to transcribe the gene to become an RNA. So far, so clear? So good? This is how it works, because this is how a lot of genetic problems start. Cancer, at the end of the day, is a problem of the DNA. If for some reason we modify the DNA such that we address a lot of the issues here, we will avoid cancer, we will avoid all of the disease known to mankind, and we will live forever. So the first concept I want you to understand is an oncogene. Proto-oncogene, oncogene. What is a proto-oncogene? Proto-oncogene is a normal gene that is expressed during development. Normal gene that is used for cellular development. When you were an embryo, you need all these proto-oncogenes to develop 10 digits, toes. You need the proto-oncogenes to develop a nose. And at some point, it has to shut off. Otherwise, you're going to have 20 noses. Right? And walking around with 20 noses, not good. Walking around with 4 legs, 4 arms, not good. So at some point, and we're still learning why or how, the body shuts it down. That's a proto-oncogene, normal function for cellular development. But for some reason, something got messed up at the promoter site or whatever it is that turns it on, and instead of having one nose, you end up having multiple noses. It just keeps revving it up. Keeps getting that message. Keep producing more noses. We need more noses. Not enough. Come on. Okay? That turns into an oncogene. So if you think about it, an oncogene is really, I look at it as like a brick on the pedal. That car's going to keep going, and it's not going to stop. Right? So you inherit a set of chromosomes from your mom. You inherit another chromosome from your dad. What do you think will happen if one of those genes got messed up? Turns to an oncogene. You will develop cancer. Okay? Because it's like a pedal, it's like a brick on the pedal. It keeps going. There's nothing from the mother chromosome, albeit it's normal, that's going to stop it. That's an oncogene. It's considered a gain of function. We will contrast that with a tumor suppressor gene that I'll talk about. So far, so good. Oncogene is nothing more than an abnormality of the proto-oncogene. How does that work? Here's a normal proto-oncogene. Remember, we talked about the promoter. Where's the pointer? Anyway.
The green button on there.
Right here?
The green. No.
Okay.
So think of it like an argon machine.
Argon machine. Zip, 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 zip. Right. So you can have along this gene, there's a point mutation. Something messed up here. Okay? If you recall, while you're transcribing, sometimes your mistakes happen, right? Sometimes you're writing a paper, mistakes happen, right? And sometimes you have editing services, or you can edit yourself, make sure it's correct. Well, you have a mistake here. For some reason, sometimes the editing service doesn't work. You get a point mutation. So this thing gets revved up. You can have amplification. For some reason, it tells this promoter to continue to produce buttload of this protein. Example is CMYC, called gene amplification. And then sometimes you can also have something going on top of the promoter here too that overexpresses it. And also, what is chromosomal translocation? Well, here's what chromosomal translocation is, because if you remember during division, you have homologous chromatids. In other words, chromosomes of your mom, chromosome of your dad, chromosome, there's 23 pairs, right? Pair number 1 pairs up, number 2 pairs up, 3, et cetera, to pair 23. For some reason, mama pair 1 pairs up with daddy pair 24, or 23. They're non-homologous. Make sense so far? Again, normally you have these sister chromatids, mama, daddy, chromosome 1, line up at that plate, right? And during that plate, they exchange genetic material. That's where you get genetic diversity, right? But for some reason, you get number 1 and number 20. Pairing up. Non-homologous. That is a mechanism, chromosomal translocation, that can create an oncogene. Right? Philadelphia chromosome, remember that? Right? This is the mechanism. Right? For some reason, the non-homologous did not line up together at that plate, and they exchange genetic material, and this is what you get. Okay? Those are the mechanisms. Well, viruses can create cancer. It was a grad student. During that time, nobody knew. It was a grad student who says, I just got this crazy idea. I wonder if viruses are responsible for causing cancer. And he studied it. And I think he won the Nobel Prize. He was taught by my professor. And when he claimed that prize, he invited my professor to, where was it, Sweden, is it? Stockholm, to claim the prize. But how does virus work? So you have a normal gene here. Okay? The C, SARC. That's a proto-oncogene, a normal gene. The virus comes in, it injects its nasty DNA, and it integrates it right there at the promoter site. You see that? Right there. And it's just going to keep revving it up. It's going to keep making this. Then it's going to package it into virions, billions of these virions, and it infects the cells, injects its oncogenic material. The normal cells become oncogenic, cancer. Clear so far? How viruses cause cancer? Again, normal proto-oncogene, normal function, infected by a virus, it jumps on at the promoter site, inserts itself, makes a bunch of these oncogenic viruses, goes on to infect normal cells transform into cancer cells. Clear? That's oncogene. Tumor suppressor genes. Its function is exactly that, to suppress tumor development. How does it work? You're born with a chromosome from mommy and daddy. Okay? During development, somewhere along the line, one of those genes got messed up. But you can still function. It is equivalent to, again, car. In a car, you have brakes. You got the pedal brakes, and you got the hand brakes, right? What happened if, can you still drive a car if your pedal brake messed up? Yeah, you can. It's not going to be good, right? Can you imagine every time you drive, you got to pull that brake up and stop it? But it still drives. Like, ain't got money to buy the car at this point. Okay? I'll get to it when I'm working enough, save enough, but for now, I got to deal with this. Okay, that or ride a bicycle. Okay? So, tumor suppressor genes, you're a heterozygote. Okay? In other words, you have one messed up gene, but you can still function. You're at risk, though, if nothing happens to you, okay? You're still at risk of developing cancer because there's a high chance of the other brake falling apart. So imagine here, you inherit this one messed up gene, and you got radiation and it zapped the other gene. Now you have what is called loss of heterozygosity. Have you heard of that term? LOH. Patients had loss of heterozygosity. That means they're going to develop tumor. They're going to develop cancer. Why? Because both brakes are not working. Can't suppress the tumors. They will develop cancer. Two normal genes, an example again. One got messed up. The other got messed up. Now both brakes are gone. So in essence, tumor suppressor genes are basically defective brakes. It's a loss of function, contrast to oncology, which is a gain of function. You may have read about the two-hit hypothesis. Remember that? You got one hit by being inherited, the defective gene. The second hit takes its toll. Loss of heterozygosity. Which prompt, I can't recall, a medical student, I gave a lecture like this, a medical student asked me, is it possible to survive, to have an embryo who is homozygote to both defective genes? Very interesting question. I went back and I looked into it. And the answer is generally no, but few exceptions. Okay? In life, there's always few exceptions. But in general, no. It makes sense, right? Because during development, you need tumor suppressor genes to shut down things that you don't need anymore. If you lost those brakes, you're going to continue to develop, and that fetus will never develop into a normal fetus. So that's why it's very difficult to find a live individual with loss of heterozygosity. Okay? Here's another depiction. Okay? Maternal, paternal tumor suppressor genes. One is mutated. That's the first hit. The second hit, loss of function, goes on to develop cancer. Can I move on? So far, so good? DNA repair genes. Example is BRCA1, BRCA2. When I mentioned before that when the polymerase starts to transcribe the DNA, it makes mistakes. You know? Right? Instead of pairing, what is it? A to what? T. It pairs to A to G sometimes, or A to C sometimes. But there is a repair mechanism where it goes back and it corrects it. It removes that G or C and it puts in, okay, the correct one was T. Sometimes it doesn't. But the mechanism of repair, there are two basic mechanisms that the body uses. It's a homologous recombination repair or the base excision repair. This is the better one. Okay? is like the brakes. This is almost like the handbrake. So sometimes the BRCA patients, they're born with basically messed up homologous recombinant. They depend on base excision. Forget the PARP, okay? And what happened is that they're prone to developing cancer. Breast cancer, ovarian cancer. Okay? What's going on here? Okay. So far, so good? What does this kind of remind you of? What mechanism? Oncology? Tumor suppressor genes? What? Rose? Yeah. Tumor suppressor genes, right? In fact, that's exactly what it is. Now you understand, if you were to take your test, BRCA1, BRCA2, R, A, oncogene, B, tumor suppressor genes, easy, right? Tumor suppressor gene. If you understand the mechanism, you got one hit, homologous recombinant repair is destroyed. You're left with the base excision repair. It will still work. What is it called if you lose the base excision repair? B? What is that condition called? Loss of heterozygosity. Now I want you to go walk around talking. Oh, this is Dr. Chu, this is a patient with a BRCA1 at risk for loss of heterozygosity. Make me so proud. Okay? This is just kind of show you, remind you how the sister chromatids exchange genetic DNA, right? Here, paternal, maternal, they go and they exchange genetic material. They can exchange anywhere. Here, okay? And here you get the resultant. This is how we develop, create genetic diversity because of the homologous exchange of DNA. Telomeres. What are telomeres? Anyone? Remember this? The end of this. Why are they so important? Every time you divide, your telomeres getting shorter, shorter, shorter. It has to do with aging also. Okay? In fact, like I told you before, if we figure out how to address all this stuff, we can live forever. If we figure out how to make telomerase. Telomerase are enzymes that add the end. The ends, okay? If we figure out how to do that, we can live forever. Because our cells can divide forever. Okay? You know, we'll have collagen so that we'll look youthful forever. Okay? That's why I joke. I said, y'all should present to me, this is a 92-year-old with a very short telomeres. Wait, you like that up? I'm glad. It's very hard to get our way to spontaneously laugh. He smiles a lot, but spontaneously laugh like that is very hard. So, in essence, that's what it is, right? If you look at it, here it is. You divide, your telomeres get a little bit shorter, so that at the end, you ran out of telomeres, you don't divide anymore, your cells die. Well, what does this have to do with cancer? Anybody? Okay, why? Right, based on what enzyme? What's telomerase? There you go, bingo. Enzymes are always in with ACE, right? And here it is. Telomerase is an enzyme that basically adds the ends of the DNA. So it becomes immortalized. So what treatment, if you wanted to attack a cancer that uses that mechanism, you would use medication that would inhibit the telomerase, right? or something to zap and destroy those telomeres of the cancer cell, right? So this is just kind of an overview of what I've talked about. I did not include a telomerase, but you know what they are. So an oncogene is, they're all, both they create uncontrolled growth, but oncogene you can imagine as a brick on the pedal is a gain of function. Okay, these are the examples. Tumor suppressor genes are basically loss of brakes, loss of function. P53 is a tumor suppressor gene. Okay, and finally DNA, both of the repair mechanisms are messed up, such as BRCA1, BRCA2, and it cannot correct cell division mistakes. That's it. Any questions? Anyone? Tell me about proto-oncogenes. Normal, right? Cellular development, right? Right. And so what happened when a what is an oncogene? Right, exactly. Brick on a pedal, right, right. And so an oncogene is really a messed up proto-oncogene, right? What are the mechanisms of the oncogene? You have point mutation. Right, right. Yeah, I love it already. She's talking about promoter. Good. What else? Translocation, remember? What are Dr. Kim, what are translocation? Chromosomal translocation. But which type? Homologous or non-homologous? Non-homologous, right? Students, what are non-homologous?
Examples being a 922 chromosomal translocation.
Right. Two, right, that are not homologous, right? Right. What's the tumor suppressor genes, Ariel?
Tumor suppressor gene is a gene that suppresses overgrowth of a
Okay,
certain
but
gene.
what's the mechanism?
The mechanism of activation or inhibition of a tumor suppressor gene.
Yeah. How does that work?
The two-hit hypothesis.
Wonderful. Two-hit hypothesis. How does that work?
When both genes are knocked out, but more commonly.
Right. And what is that called when both genes are knocked out?
Loss of heterozygosity.
Loss of heterozygosity. Beautiful. And how does so you inherit the first one, right? That's the first hit. The second hit may be what? Chemicals, food you eat, radiation, whatever it is. They're very prone, right? What about DNA repair gene?
So you're talking about BRCA1,
Mm-hmm.
DNA repair genes, and that's one mechanism for repair. That's the homologous recombination repair.
Right.
And you also have the basic excision repair. So if you knock out both, you no longer have a...
Beautiful, beautiful. I'm glad you guys are paying attention. Right. All righty. All right. Guess what the last question is going to be? Telomeres. Tell me.
Telomeres are dense.
Are your telomeres longer or long?
Oh, mine are longer than yours.
Okay. All right.
It's not about the size of the telomere.
Actually, it is.
So, after I asked that, I'm like, oh, crap. Okay. So I said that. Okay. My bad. So right. So tell me about telomeres.
Telomeres are dense CG repeats in the ends of chromosomes
Right.
that protect.
And what happens to them with each division?
They shorten with each division.
They get shorter and shorter, right? So how does cancer bypass that?
with telomerase,
Right,
which adds more bases to the telomere.
exactly.
Just tell me.
So, in a span of half an hour, I hope you learned something. Now I want you to go back to those chapters. I want you to read them. Hopefully they make sense. Okay? If there's something that I explained here that doesn't make sense, let me know. Feel free to. To me, this is very obvious because I deal with this routinely. So if it's for some reason you're like, Dr. Chu, I don't understand this. This doesn't make sense. What about this? What about that? This is the time to ask. We have 15 minutes. Any questions? Clear as mud? Good. All right, thank you.